Did you know that you could add 10 years to your life just by eating certain foods? Well, a new study revealed that a certain vitamin can reverse the aging of your heart. Christopher Speed is here. He's a registered dietitian and nutritional scientist, and he's going to explain all this for us. Hey, Christopher, good to see you.
Great to see you too.
And welcome back to Let's Talk Live.
It's a pleasure to be here.
Third time's the charm, right?
That's right, exactly.
So tell us about this new study, Christopher.
Well, the new study that really has made nutrition such an exciting thing to talk about is an ingredient called MENAQ7K2. In the study that you mentioned, it actually showed that if people added this MENAQ7K2 ingredient to their diet, they could add as much as 10 years to their longevity.
What is in this thing? Oh my goodness!
Well, it's a vitamin called MENAQ7K2. It's MENAQ7, and it's actually a vitamin K2 ingredient. What it does is it actually shuttles calcium from where it actually can harden your arteries and actually push it where it's going to be beneficial into your bones.
Wow.
So if you take a calcium supplement, if you eat what most Americans do, a very high calcium fortified diet, make sure you add that MENAQ7K2 to your regimen.
And you can get this at any supplement store?
Any supplement store, CVS, Walgreens, any of the prominent ones around the country.
All right, well, let's talk about some of the more normal things. I mean, because first of all, we know when you're talking bone health, you're thinking calcium, right? That's
correct. So we're not saying don't take calcium, but just make sure it's with that vitamin K2 ingredient as well. And this doesn't replace good basic eating. At the end of the day, you should have a good weight, and you should eat a whole bunch of foods that are essentially from plants, ranging from kale to fruits and wonderful vegetables. Even there's banana and strawberry smoothie here. Enjoying fruits and vegetables and making sure they are the foundation of your health and what you eat. It also includes other nutrients that, quite frankly, we don't get enough of in our diet, especially if we live in a certain part of the world. Most notably, vitamin D3. Vitamin D3 is also being shown.
The sun vitamin, right?
Exactly. So, this time of year when we're coming out of winter and we haven't had, quite frankly, enough sun, adding some vitamin D3 to your regimen can do a great deal of help. Also, it affects arterial health.
How much do you need of that?
Vitamin D3, 1,000 to 2,000 plus international units a day is what's been recommended. And I've even heard certain physicians put people on several more thousand of that a day.
So, okay. And that's really important, especially as you age, maybe as your bones get thinner. And
correct. It's really important to make sure you do add vitamin D also again for your bone health, not just your heart health.
So is it important to combine the calcium with the vitamin D?
It is. In fact, it really should be calcium, MENAQ7, K2, and vitamin D. They should be the three important nutrients for any bone-healthy supplements that aren't going to hinder your cardiovascular health as well.
And do you need to take these with food?
You don't need to take them with food at all. That's a great thing. It's just a matter of simply adding it to what you're currently doing.
Okay, these are things people don't know to do, right?
It's new science, and it's really exciting science, and what it shows is why food nutrition is important and how it affects the arterial health. The stiffness of our arteries predicts our longevity. So it's an important thing to know what nutrients are key at reducing and improving your overall heart health risk.
So we've been talking about bone health, but this is also having to do with your heart and the arteries.
Correct.
And what we're trying to do is prevent the calcification of arteries.
That's exactly
which happens as we age and with the wrong foods.
It's a typical aging element, and what we can do is eliminate that by adding that vitamin K2 ingredient.
Yeah, I remember my grandmother had the hardening of the arteries as she aged, and it was quite debilitating as she got on, because when she would just walk the littlest bit, she would get these searing pains down her legs, and it was all because of the arteries.
From a public health standpoint, it's a very serious thing, and we can do a lot with nutrition to prevent that, and really understand what nutrition does and how it can really assist us.
All right, what about some other nutrients? I mean, we're talking about potassium, right?
Potassium is an important one. Magnesium, any of the electrolytes, they are also important for promoting a healthy heart beating. They also, again, assist with a clean and a vascularized system, so your arterial walls aren't being stiffened. There are also other ingredients and nutrients that we're not even mentioning here. The number one most researched is omega-3s from fish. Omega-3s are important, and we should really also try and add those to our diet through whole fish and also supplemental approaches.
Okay, the thing about fish is it's sort of, well, you hear it's so good for you, and then you hear, oh, you can't have farm-raised fish, and so then you try to find the wild ones, and they're very expensive.
It is.
Then you hear, well, you shouldn't have too much fish because then you get too much mercury in your system. So when it comes to fish in your diet, how much per week is enough?
Well, there's been recent dietary changes for pregnant women that actually say consume more. The more fish we can consume, the better our heart health will be impacted. All these reasons, from cost, affordability, ability to actually cook the fish, which is another hindrance to why people don't consume our fish, it really leads to why we do need to take those supplemental forms of omega-3 as well, because they are removed of all environmental contaminants, they don't taste fishy, and you're still retaining the essence of what omega-3s can provide.
What does magnesium do for us?
Magnesium, like any of the other electrolytes, supports healthy blood flow. It also supports how our heart beats, so that every time that heart is beating, you're getting the optimal amount of blood circulating around your body.
And this can be found in a number of foods, right? I mean, we can just get this naturally if we eat right.
You definitely can. Magnesium, any of the electrolytes, are commonly consumed in most fruits and vegetables, and that's why the foundation of any new food has to start with whole foods and the importance of consuming ample fruits and vegetables.
You're talking about eating all this good produce. How do you feel about organics? Does it have to be organic?
I personally don't believe that you do need to consume organic.
You don't?
There are many people in our society that quite simply can't afford organic. So from that standpoint, I believe that people should have the choice. But I'll tell you what, if you gave me an organic apple, I know I'm going to really, really enjoy it. But from an affordability standpoint, that's the only hindrance towards organic foods.
What do you do about the possibility of pesticides being present on the spray, the bug sprays that they, on all of the fruits and vegetables?
It is important to be really careful of that, and there are really good vegetable and fruit cleaners that you can actually, very affordable, that you can actually purchase that actually will remove a lot of that from the flesh and the actually outside of the fruits. So I would definitely encourage you to clean your products and do research. Which ones are the worst? Which ones do you really need to buy organic? Perhaps it's the strawberries that tend to take in a little bit more of these PCBs and the environmental contaminants.
The dirty dozen.
Exactly.
Yeah.
As opposed to an orange where you're taking the skin off and you're consuming basically what's inside.
All right, so what we have to remember are the nutrients over here, the calcium, the vitamin D, the potassium, the magnesium, and the omega.
Q7K2.
Q7K2, which I have forgotten already. Thanks for coming in today. Christopher Speed, he's a registered nutritionist and dietitian. Thanks so much.
Thanks for having me.